Just wait, let me check. Yeah. Okay.
Yes, it's live. Now I think we can start.
Okay, good to go. You can start now. Yeah. Sorry, everyone. You have to wait long time, you know.
Sorry, Bubu, you are muted. Can you unmute yourself, please?
Sure. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Good morning, good afternoon, and good evening to our respected guest speakers today and supportive audience who are joining us today through Zoom and Facebook Live from different parts of the world. Again, I would like to welcome you back for our fourth webinar, which is our final webinar of our project called Supporting Rohingya Refugees to Address the Impact of COVID-19, which we are hosting in English today. Furthermore, let me introduce you to our respected guest speakers today. We have 5 guest speakers today who are working very closely with Rohingya community in Bangladesh and Rohingya in diaspora. Our speakers are Ms. Nasha Nick, co-director of our organization, our own organization, Rohingya Women Development Network, RWDN, Ms. Natalie Brinham, Senior Program Officer of Institute of Statelessness and Inclusion, ISI. Our elder sister and one of well-known Rohingya activists, Dr. Ambiya Perveen, Chairperson of ERC and co-founder of Rohingya Medic Organization. Our fourth speaker is Ms. Veena Pillai, medical doctor at MSF. And finally, our brother, Ali Johar, head of education at R4R, and also led and also our head coordinator of this project, Natalie Johar. I think that's all. Once again, welcome to our webinar, and thank you so much for taking your time for us today. So just before we start our discussion today, allow me to brief introduce our project again with you about, why we are here, what we have been doing. As I said, this is project called Supporting Rohingya Refugees to Address the Impact of COVID-19. It is a project under the COVID-19 Emergency Statelessness Fund, which an award from CESF committee that Rohingya Women Development Network, RWDN, received, which has received under the Institute on Statelessness and Inclusion, ISI. So this project, objective of this project is to strengthen the capacity of vulnerable Rohingya refugees, to reduce the spread of COVID-19 and mobilize the community by awareness raising on COVID-19 and related health issues in Bangladesh and beyond. To accomplish our goals, we hired refugees and stateless persons from 35 camps in Bangladesh who took part on the ground awareness campaign COVID-19 and with both men and female in Rohingya community. Also, the wider Rohingya and international community able to access information and data related to pandemic and current situations of Rohingya living in Bangladesh, India, Myanmar, as well as Malaysia through our online webinars. and webinar discussion, which we hosted 3 other webinars in Rohingya language previously, which we cover different situation, different issues that Rohingya refugees are facing, especially during this pandemic. In this webinar, we invited expert researchers, scholars, leaders, doctors, and community organizers from within the Rohingya community to represent the group, and invited distinguished contributors from different host countries to elaborate on selected issues through our online platforms. This project combines online and offline tools to reach people in need during the pandemic and to undertake research to understand the needs. This project we planned it for 6 months. The duration is 9 months, and it started from 1st of December 2020 and to 31st of August 2021, which means we are end of our project now. So that's a little bit of our project. Our brother Ali Johar will be sharing more about our project. So, by not taking a lot of time, now I would like to welcome our brother Ali Johar to share his, experience and more of detail or information related to our project, which is again called Supporting Rohingya Refugee to Address the Impact of COVID-19. So a little bit about our brother Ali Johar before we start. Ali Johar is the head of education at Rohingya Human Rights Initiative based out of New Delhi, and he is also a recipient of prestigious Social Change Initiative Fellowship. Ali's interests are in statelessness, refugee laws, forced migration, and detention-related issues. Lastly, he is a lead project coordinator at our project again, which is supporting Rohingya refugees to address the impact of COVID-19. Brother Ali Johar, the floor is yours.
Thank you very much for joining us today here. And in fact, thank you very much to Sharifa for such a nice introduction. So as she has already described about our project, it was approved and funded from the CESF consortium, and it has been supported by ISI, that is Institute on Statelessness and Inclusion, and the project has been jointly implemented by Rohingya Women Development Network, Rohingya Human Rights Initiative, and also other Rohingya activists who have supported us immensely from reaching out to the community as well as in the implementation part. Obviously, ISI's part in helping us implement the project and developing tools, materials to support the community in better way was very vital. So this project is actually threefold, where we have a study conducted where we have tried to find out what are the problems and impacts that have took place within our community in Myanmar, Bangladesh, India, and Malaysia, as well as beyond. So that I'll light on afterward. So there is a field work where in Bangladesh we have supported 20, we have had 20 volunteers to support 80 religious leaders to conduct sessions on COVID-19 related issue and how to cope up with the situation. As well as we have reached out to 800 women with COVID-19 related awareness session, and also with dignity kits like dignity pads, masks, sanitizers, and posters, and with related information. So from all these religious leaders we have collaborated with, they have reached out to hundreds of general Rohingya refugees in the camp. And from the women we have reached out their household, 800 household has benefited from the information, as well as the little support we were able to provide. So I will pass the floor to our other speakers, as we have already missed a lot of time in the starting and technical issues. As Dr. Ambiya Perveen is about to leave, I think we'll start with her. Then I'll definitely light on the project findings later on. Thank you very much.
Thank you so much, Brother Ali Johar. Just before we go to our next speaker, we have seen, we are looking at the people are raising hand to ask for questions. So audience, if you have questions, please hold your questions. After the end of our speakers, you finish their presentation and their speech, you can ask as much as question you want. If you can direct the question who you want to direct to, that will be great. You can write it down, or you can raise your hand later on. So thank you. I forgot to mention that earlier. Okay, so by not taking time, we invite our, the next speaker, which is one of our prominent Rohingya activists, Dr. Ambiya Perveen. Dr. Ambiya Perveen is the incubation chairman of ERC, founder of Rohingya Medic organization, and also advocates for Rohingya women and children's affairs and rights. She is a prominent Rohingya pediatrician and a children's pediatrician working in Germany. She was born in Myanmar and led to leave her country at the age of 5 with her family. She visited the camp and doing online consultation with PTBS and rape patients from the camp. She was also the first doctor who did the medicines in Arakan, especially in Sittwe, when MSF left in 2014. Our sister Ambiya, our elder, please go ahead with your speech.
Assalamu alaikum, wa alaikum assalam, and good evening, good afternoon, good morning. It was a very long brief, though I don't deserve, I think so. But thank you for your generosity. And I thank all the organizers and the speakers in advance and the audience who are taking part here. Before I continue talking about the COVID and the consequences happen in our country, and especially in Bangladesh with the Rohingya community, we Rohingya would like to offer our sincere sympathy to you, to your loved ones, to your family members, to friends, and kindly accept our condolences for the loss of the lives due to COVID-19. As we all know, that our world is populated with almost 8 billion people we are living in this world. And out of it, according to the WHO from yesterday's update about COVID, is that so far 218 confirmed cases are there, and out of which deaths were 4.54 million have died so far. And first dose of vaccination received by 5.34 billion, and fully vaccinated were 2.13 billion. Let us move to our country, Myanmar. The data that I've collected from yesterday is that, though it might not be a clear data, and I don't know how much is authentic, is that Myanmar is consisting of 54 million people. And out of in Myanmar, 6.25 million people got first dose of vaccination of COVID-19, and fully vaccinated were 1.8 million, which means 3.3% population is fully vaccinated, according to yesterday's data. Let us go to Bangladesh, where, according to the UNHCR, where 1.1 million Rohingyas are living in Cox's Bazar, there have been only over 4,000 Rohingyas were vaccinated. The population was above 55 years old. So that is the data, and we don't know what will happen future with the vaccination. They received the first dose, and there were no data provided from the Bhasan Char Island. If we go to the majority Rohingyas still living in Myanmar, and especially in Arakan, last month, the vaccination has started, and the priority was given to the elderly people, the governmental staffs, the medical staffs, and the Buddhist monks. Unfortunately, again, the Rohingyas and the Muslims living in Arakan were ruled out, and there is no further information provided when they will be given, these Rohingyas or the Muslims will be provided vaccinations. So the disaster happened by this COVID-19. Unfortunately, it continues. The virus is spreading day by day. There are new mutations are coming, and the increase of COVID cases in children are increasing daily. As usual, women and the children are the most affected people when it comes to war zones, conflict zones, and also in this crisis, in this COVID crisis. We should not forget that these Rohingyas, they are very fragile people due to their systematic persecution done by their own country, and being the victims of genocide waves. There are 1.1 million Rohingyas are living in refugee camp in Cox's Bazar, and still from 500 to 600 Rohingyas are living in Arakan. As I've said, we women and the children are most affected when it comes to any crisis, and this happened again with the Rohingya women and children. Let us go to Bangladesh. We are very thankful to Bangladesh. And despite of the international support and the local support from Bangladesh, the living standards has not at all reached to the basic human rights in Bangladesh. Our people who fled their country out of fear, they continue to suffer further. And also in Arakan, after the coup, due to the fight and the atrocities in Arakan, Rohingyas continues to suffer, and the genocidal tools continues further. We women, Rohingya women in Arakan and in Bangladesh, due to the lockdown restrictions, due to the unemployment of their male genders, due to the blockage in Arakan, especially from the international community, humanitarian aid, and also schools were closed. There's no medical staffs. There's no medical facilities. We Rohingya women continue to suffer further along with our children. You might have seen, you might know that in refugee camp, the situation and the dire condition of the Rohingyas continues. Our women are living overcrowded due to the COVID. Their sufferings have increased. They have to face their elderly, they are men who are in tents as they cannot move freely and work freely. Their children are majority of the time at home. Their adults cannot go for their medical facilities. So they have to take carrying the burden further. There's a very small amount of psychosocial support in the camp. And also, beside that, there's a huge security risk of sexual abuse, thefts are continuing, and the domestic violence. So as I've said, these fragile people continue to suffer further, despite of enormous help from the international community and from the locals of Bangladesh and the government. I leave the floor further so the other panelists can speak, and I will try to answer your raising questions. Thank you.
Thank you so much, Dr. Perveen, with your insightful information. Now we would like to invite our another speaker, Ms. Natalie Brinham. Sorry, I have problem spelling out people names. I'm so sorry for that. She is a Senior Program Officer of Institute on Statelessness and Inclusion, ISI. Natalie contributes to different areas of Institute's programmatic work. She develops research and advocacy approaches to address the human rights situations of Rohingya in Myanmar and in refugee or stateless situation elsewhere. Additionally, she also works on childhood statelessness and provides tolerance support to activists. She is also a PhD student at the International State Crime Initiative, ISCI, Queen Mary University of London, conducting narrative research on legal identities and ID cards. She holds a BA from SOAS and an MA in Education, Gender and International Development from UCL. She has worked for many years in NGOs in UK and Southeast Asia on forced migration, trafficking, and statelessness in both frontline service provision roles and research and advocacy roles. Ms. Natalie also one of the silent contributors in Rohingya cause from the start. And we are very honored to have you here today. And please go ahead with your presentation. Looking forward.
Thank you very much. Very good introduction. Also, thanks to everybody for the opportunity to speak today. It's very nice to be beside so many prominent activists and people working for their community. And also thanks very much to the audience today. Thanks for being here and listening to what we have to say. Since I work in the UK, I don't have very detailed insights into particular local contexts, but I do get a very broad overview of the issues and approaches to COVID-19 pandemic from Rohingya communities and others affected by statelessness as well. Today, I wanted to provide some reflections on the impact of the pandemic on refugee communities generally, on the response of the Rohingya community workers and activists to the pandemic, and also on the response of the human rights community, and in particular, the CESF, which you've already heard about from Sharifa. So firstly, a couple of brief reflections on the impact of COVID-19 on Rohingya refugee communities. Rohingya communities, as we know, are so spread out over so many different countries due to decades and different triggers of forced migration. So in looking at the pandemic, ISI together with activists tried to understand the impact across different country settings. Some of the impacts were very similar in different situations, and that's what I want to draw attention to today. In almost all the situations, the pandemic and the resultant restrictions and lockdowns exacerbated the existing vulnerabilities of Rohingyas that were linked to their precarious legal status. Towards the beginning of the pandemic, for example, we saw firstly the impact of movement restrictions. So border controls and internal travel restrictions made it more difficult for Rohingyas to claim asylum and also to access refugee protections. So we saw both in India and Malaysia, more Rohingyas being caught up in immigration detention situations and often without the means to get out. And we also saw an increased risk of arrest, particularly from internal movement restrictions as a result of the pandemic. And secondly, on the movement restrictions, they had a really devastating impact on the livelihoods and food security in various different situations, including in Bangladesh, in India, and in Malaysia. And with the lack of a social safety net that citizens have, it became much more difficult for Rohingya refugee communities. The second issue that was very similar in multiple different contexts was the rising xenophobia, including hate speech, racist abuse and attacks, exclusions from the workplace, and exclusions from rental accommodation and also from public spaces such as markets, etc. The third similarity we saw across multiple different situations was the increased difficulty in accessing healthcare, education, and basic services. So while it was harder for citizens too, it disproportionately impacted those without citizenship or those without documents. Often this was not just access to health for COVID-related issues, but also accessing medication for existing medical conditions, or accessing, for example, antenatal services or mental health services, and also accessing public health information in ways that was accessible. The fourth major impact that was similar across the board was the gendered impact on Rohingya communities. And I won't say any more about that because I think Dr. Ambiya has covered that very, very well. So with all these issues on the rise, it was really frustrating for the Rohingya community workers and activists who wanted to support their communities, particularly with stuff like public health messaging, health access, and humanitarian support. Often the lockdowns and also the internet and mobile phone restrictions that were in place at the time made it harder for community workers to work. It wasn't only Rohingyas, but other communities with precarious legal status and those who were stateless that were struggling with these issues. So in response, the CESF, or the Covid-19 Emergency Support Fund, was set up. And it was a consortium of organisations that would enable community-led responses with some donor backing. So next, I just wanted to offer a few reflections on Rohingya community work and activism. And I think many people would agree with me when I say that since 2017, there have been some really important developments in Rohingya community activism. Rohingya-led and organised initiatives in international circles are no longer the exception, they're the norm. And Rohingya voices are no longer used as tokens within the parameters of NGO-defined advocacy projects without that going, that doesn't go unchallenged anymore. Rohingyas have really become the centre of knowledge production about themselves, which was very well needed. But this past year has been a massive challenge for Rohingya community workers and activists, and also activists in Myanmar and those working with them. So COVID-19 and the associated lockdowns have made the working environment really challenging, often preventing face-to-face work and increasing the vulnerabilities of the community. And various internet lockdowns imposed on Rohingya communities have also made things even harder. So activists and community workers have needed to also take care of their own families in the economic and rights fallout and because of sickness. So in addition to this, the crimes of the Myanmar generals this year have engulfed the whole of Myanmar, while the pandemic with its manic factors has sadly taken the lives of many activists, their friends, colleagues and family members. It seems sometimes like week after week, the messages and social media feeds were a stream of just endless notifications of the deaths and arrests of prominent people and activists. People desperately trying to stay safe from military violence or trying to secure oxygen against the odds for poorly family members. And this has had a really huge emotional toll on Rohingyas and other people of Myanmar, and has resulted in this sort of 360-degree conflict since the February the 1st military coup. So it's really amazing that community work and activism continue. So while the events in Myanmar have triggered some really important linkages and a growth in the solidarity of the Rohingyas from different communities, the conflict's also depleted from Rohingyas' hope of returning to their homelands in Myanmar in safety. And unfortunately, the lack of solutions for Rohingyas to return Myanmar has a knock-on effect, which prevents other states from working towards durable solutions for Rohingyas in situations of protracted displacement or intergenerational statelessness. Nonetheless, it's been very inspiring to see the responses of Rohingya community workers and activists working at the ground level to address COVID-19 against the odds. The resilience in working for their communities has been super impressive. I hope the work that has been done with COVID-19 also puts down some building blocks from which Rohingya groups, human rights organizations and the donor community can work in more effective ways with Rohingya groups and those who are stateless or have precarious legal status. And this duty or need for the human rights community to work better has been acknowledged by the consortium working on the CESF. And one of the things that has come out of that is a roadmap. So drawing on the experiences of the CESF consortium members in their COVID-19 work over the last year and a half, the roadmap has been devised. It aims to inform and guide the responses of multiple stakeholders, governments, parliamentarians and political parties, professional bodies, regional organizations, UN agencies, etc., etc. And it put down 3 steps. So the first step is to check for institutional blind spots. So all these stakeholders should engage in careful introspection for institutional blind spots and review and reform policies and practices to ensure that stateless people are prioritized, their particular contexts and needs are understood and addressed, and they're not excluded or left behind through, and to do this, they're using strengthening awareness of the issue at all levels, acknowledging historical failures, and collecting and sharing information on statelessness and nationality rights. So step 2 is to consult and engage in dialogue. So those people in positions of power should engage with others to have open consultations and meaningful and constructive dialogue with affected communities, and commit to including stateless people on equal terms by consulting with activists and affected communities, building trust and strengthening solidarity, meeting the needs and priorities of affected communities through meaningful participation, and facilitating wider discourse within society on equality, inclusion, and the right to nationality. And the third step in the roadmap, and the final one, is to build back better. So all actors need to learn the hard lessons that the pandemic has taught us and invest in future-proofing, ensuring a lasting commitment to breaking down the pervasive injustice and dignity inequality, deprivation, and exclusion that people face. By focusing on implementing legal reforms, redressing intergenerational disadvantage and the legacy of statelessness, being accountable to communities and activists, monitoring the performance and progress of states, ensuring access to justice and reparations for stateless people, and sustainably investing in inclusive society. So I'm going to finish there and hand over to other speakers. Invite your questions later, and thanks again for the time.
Thank you so much for acknowledging. I mean, first of all, you have said so many, things. And firstly, I would like to thank you for acknowledging the improvement of Rohingya community, since 2017, which is, I think, it is a big improvement. There's a lot of things being improved, and we working together, and stuff like that. So thank you for mentioning that, and also mentioning about the information how COVID had impacted Rohingya more compared to the citizen, how Rohingya become more vulnerable in this situation, in this pandemic, as well as the a very useful suggestion and roadmap how to work with Rohingya community directly, and how important it is, the steps. So thank you so much for all of that. So now we have another speaker, which is one of my closest people in my life, our co-director, Nasha and Nick. She is co-director of Rohingya Women Development Network, RWDN. Little bit about Nasha. Nasha builds the capacity of Rohingya and Myanmar Muslims refugee at Rohingya Women Development Network, as well as at Host International. Prior to that, she served refugees from Middle East, North Africa, Central Asia, and Myanmar through livelihoods and integration initiatives at Malaysian Social Research Institute, MSRI. Nasha worked as legal advocate at Asylum Access Malaysia in 2015, and she was admitted to the bar in Victoria, Australia in 2011, where she practiced as a criminal lawyer before returning to Malaysia. And personally, Nasha have been improving and helping, a very good helping hand to the refugees in Malaysia. So, with a lot of love and respect, Nasha, the floor is yours.
With a lot of love, thank you, Sharifa. Assalamu alaikum, everyone. Thanks for making the time to be here with us today. I'm sorry we all started a bit late. I'm really glad that Dr. Ambiya went first. Well, she has to leave early, but I'm glad she went first, because thank you so much for the confronting reality of the situation in Bangladesh, and also Brother Ali for starting off with your presentation. And I look forward to finding out about your findings after this, and also Natalie. I am the co-founder, I'm the co-director of RWDN. It's interesting because typically it's me listening to Sharifa, and I'm only here as a representative. The main people who are actually working at RWDN, Saida, Fatima, Zulaika, and Laila, they're not here today, but they're listening to us on Facebook. I saw that they all logged in. I actually prepared slides for this evening, but given that we're sort of running out of time and I want to paint a more accurate picture of what has been happening, I don't want to get distracted with the slides. And that's okay, right, Sharifa? I think I might not use that for now. So just for those who don't know what RWDN does, RWDN is an organization that started off in Malaysia by Sharifa herself. It has been for the past 5 years a safe space for women and girls, and they typically attend this center to receive education, skills training, and also where they receive empowerment programs. I started off as a volunteer even when Sharifa was still in Malaysia, only managing the skills training. And now I've taken on to overlook this, the organization. And as I mentioned, the 4 hardworking people are Fatima, Saida, Zuleika, and Laila. So I would like to just sort of paint a background, give a bit of a background of the community in Malaysia, in case not many people might know this, but the Rohingya community make up the most of the majority of the refugees in Malaysia. It's about more than 100,000. But prior to the pandemic, I think RWDN only served, we didn't even reach half the number of that. But what the pandemic has shown us, and from until now, given the amount of people that have come out for help, I think our reach has been more widespread, not just in Kuala Lumpur itself, but in different states as well. Prior to, so pandemic hit Malaysia in March 2020. And the Rohingya community unfortunately received the brunt of the hit from the community. Just like what Natalie was saying, internationally, it's the same in Malaysia too. The xenophobia sentiment was at the highest, and it was very unfortunate that the Rohingya community had to take it in. The first cluster of COVID in Malaysia unfortunately happened from a tabligh that happened. No one could actually identify who were the participants that attended, but rumors just spread out saying that majority were Myanmar Muslims or Rohingyas, and unnecessarily they were seen as targets. I think it was also a state of everyone being terrified, everyone not understanding what is this pandemic, and everyone having to deal with lockdown. So it was very unfortunate that they received the brunt, and it was very difficult. We've been in this for a while now. This is already September 2021, so my tone might change along the way. So I'm trying to put myself back to when we first started. When it hit us in the beginning, it was hard because at the time, not just only the refugee communities, like the local marginalized communities, the indigenous communities, we all needed assistance, but we were struggling, or we were afraid. We had to tread carefully in asking assistance for the Rohingyas, for instance, because we weren't sure how it would be received. But thankfully, to those like activists or supporters of our work, to the years prior, everyone was in full support. And I think for the first few months, our priority was ensuring that everyone got food aid, hygiene aid. It was a hit because a lot of people, when lockdown happened, not just Rohingyas, but like just generally, everyone lost their jobs. Everyone was losing their source of incomes, especially weekly, daily wage earners. And because of the negative sentiment that was directed to the Rohingyas, it made it even worse for them. They weren't even warned. It was just, they go into office and they were just told off, even by like landlords who had no problem like renting their houses to Rohingya refugees. Prior to that, they were afraid of what the government might do to them, so they started evicting them. And so we started getting cases of evictions, of people not having enough money for food. So in the first few months, the focus was just on ensuring that we were providing safe spaces or providing food aid and hygiene kits. And then in the following months, like I think from July onwards, raids started happening in Malaysia. Actually May, sorry, during Labor Day. Raids started happening, migrant workers, they were the local, the immigration department, the authorities were going to various places where most of them work. They were raiding them, detaining them, arresting them. And because of that, a lot of women lost their support, not just because most of their husbands are the breadwinners, but just because they don't know how to navigate in Malaysia. And because of that, RWN started getting receiving a lot more calls from these women. So on one hand, we had women who were losing their support from husbands who have been detained, but also I think it was Natalie who mentioned, what was it, Dr. Ambiya, about, yeah, Dr. Ambiya was saying about how in Bangladesh, because you can't, because everyone was in a state of lockdown, everyone was getting agitated and they couldn't go out, and that really stressed out a lot of the men. So we were also getting a rise of gender-based violence cases as well. And they were contacting our community leaders, asking for assistance or just someone to talk to. And we started realizing, after discovering all of this, we started expanding our services to provide safe shelter placement. So what it was for 3 months, we had a criteria. In the beginning, we were only able to assist 15 women, but we helped those, especially whose husbands have just been detained, in providing assistance. This assistance came in support of rental support. It came in support of food support as well, and also generally to have that sisterhood support system with the Rohingya community. Again, our community leaders are amazing. They're the best sisters and mothers we have, and they were looking out for them, taking care of them. At the same time, we were also receiving people who had just arrived by boat from Aceh, or from mainly from Aceh. They were mostly younger, like minors, but there was also a rise of needing to house them. We weren't prepared for it, but we had really amazing community leaders who were welcoming and took them into their houses just for temporary shelter until we could find someone. Typically, they would have relatives in Malaysia, so until that could be located. And all of this, of course, is not just through RWN. I'm not mentioning organizations, agencies, but it was all the help that we're getting here is collaborative effort with like Host International, UNHCR, ICMC, and Global Shepherd. So the Safe Shelter program in 2020 was really helpful because we also provided livelihood assistance. One of the main programs actually at RWDN in Malaysia is providing income generating activities. This was something that Sharifa believed to be, and it is what to be a tool of empowerment. We really truly believe that once the women themselves can start earning money, it will empower them to be more independent, confident. And from when Sharifa was here, that has been the case, and even more so during the pandemic, because we had these mothers these women whose husband had been detained coming into the centers to so at the time we were in the past 2 years, we have been heavily producing reusable masks and reusable sanitary pads. And it's been a blessing for all of them, actually. And the reusable so the productions of that, I actually in my presentation, I was going to explain more on the projects, but I think it's probably worth just noting how beneficial it has been, because when we started the reusable sanitary pad project, for instance, it was before the pandemic, and the idea was for our community leaders to reach out to more women in Malaysia, not just to teach them these income generating activities, but also to give them a voice and teach them how to be part of an empowering community. But because of the pandemic, it had to be changed because we couldn't meet in social spaces. We changed the concept to be the production of reusable sanitary pads. And because we had an abundance of it, I mean, the women needed to earn, we needed to continue producing the sanitary pads, but beautifully donated it to different communities. So we gave it to the Somalian communities, the Afghan communities, but also detention centers. And until now, and we will continue be providing to detention centers until next year, and hopefully if that contract continues. But so like it progressed. We didn't expect this, but we all, as a community, all the women at RWN grew together with how the pandemic progressed. In 2021, we continued that safe shelter program that we had in in last year, but now we are serving 25 women, still targeted for women who have, but this time there's an additional, so not only it's for women who are survivors of gender-based violence and also with husbands who have been detained, but also to those who have lost their spouses to COVID-19. I'm really sorry it happened, a lot of our activists, a lot of our community members in Malaysia were affected by it. Every week we're hearing, not almost every day, but like every week we are hearing someone prominent passing away, and we do our best to support the wives of these people. We've also lost some of our own women, actually. If I can mention, we lost a very important seamstress at RWDN, Jumabi. She left a husband and a child, but she was one of our best seamstress, and it took her in a few days. She had an illness. She went. It was shocking to all of us, but so this has been happening, and we extended our support to the husband as well. We didn't give shelter placement, but for our love for the child, especially, she left one daughter. So we extend our assistance to her as well now. So that's the difference with the program this year. And also with the Safe Shelter program this in 2021, UNHCR and Global Shepherd has been very kind to also hire 2 more people from the community, which is why now we have Zuleika, who's the caseworker, and also Laila, the coordinator. So on top of that, providing safe shelter, they're also case managing these women, which means that they are actually interviewing, spending the time getting to know and addressing all their needs, whether they need counseling, whether they have medical attention that needs to be attended to. We are also providing expressive art therapy. RWDN is just amazing, actually. The women have been working the hardest in the past year. On top of that, I think one of the important works that we're currently focusing now is getting the vaccination rollout. For this, prior to, let's say, I think the vaccine rollout started probably like end of May here in Malaysia. Prior to that, we were all very nervous just because of the sentiments that was directed to the Rohingya refugees before this. We weren't sure if the refugees in general would be getting vaccine, but Alhamdulillah, our government wants actually everyone to be vaccinated. So, and that is inclusive of refugees as well. And a lot of the people from our community are getting vaccine. All our community leaders are vaccinated, double dose as well already now. And prior, we also had like we had a problem with those who were undocumented, because not everyone has UNHCR card in Malaysia. But even that has been solved through various amazing initiatives in Malaysia. There are small pockets of amazing groups that are doing their best to ensure that everyone gets vaccinated, regardless of whether they have documents or not. So the 4 people in RWDN are actually working really hard, chasing after them, and making sure that they get vaccinated if they don't know. Because in Malaysia, most of the registration happens on smartphones, like you have to download an app and that's what happens. And given the illiteracy rate, it was a problem, but thanks to the community leaders and then organizations like Asylum Access, who have created like videos actually like listing down step by step on how it can be done, it has been great. And also the technical teams in the different vaccine locations have also been very understanding. They haven't actually like pushed like refused anyone's service, and if anything has been very supportive in trying to accommodate and making sure that they do get vaccinated. We're hopeful that this will reduce the death or infected rates among the Rohingyas in Malaysia. As I mentioned, those who were infected or those who unfortunately passed away, from what I know is that they were not vaccinated, or they had already only just received, actually they had not been vaccinated at the time, which is very unfortunate. And of course, we'd like to believe that, if only they had been vaccinated a bit earlier, maybe they could have been saved. But so right now, that is what we're doing. That's what we're doing our best, trying to just make sure that everyone gets vaccinated. Other than that, another positive thing that has come out of this is we never thought we'd be able to conduct classes online, but the Rohingya community, especially with RWN, we have successfully managed to conduct online classes this year in 2021. Probably the only organization, I don't know, I should probably check this with the rest of the refugee organizations in Malaysia, but so far I only know about RWDM, but we have successfully conducted a 6-month digital literacy class. We've had livelihood classes online, and also now currently there's digital marketing classes online. So it's been amazing how quickly everyone has adapted to having to use technology. All their children attend schools online and have had no issue with it. There's no issues of getting connected or participating. There's no real dropouts. If schools, it's the same with those local children, as in any issues that they have. Sure, smartphones are limited per family, but so far I think we've managed to work it out. Either they borrow like relatives' phones, or parents understanding their children's needs, allowing them to use their phones first, and then they've all managed to work a system. So as I was saying earlier, the tone has changed from March 2020 to where we are now. I have to admit, like, I'm very much only focused with RWDN, but this is what has been happening. And until now, weekly, we are still assisting with food aid and hygiene products. Just before this call, I received a call from Saida, who is listening now, who said that we have now 130 packs to be distributed tomorrow for hygiene packs. And we're really now just reaching out to the pockets of Rohingya communities that we have not before. And that's also one of the great things that has happened, because prior to the pandemic, we were always working, strategizing on how to reach out to the Rohingya community in other parts. But now, thankfully, not to say that they are coming to look for us, but it has made the job easier. And I think we're really slowly building up that sisterhood to support one another. Yeah, I think that's all from me, Sharifa, if that's okay. Yeah, thanks everyone.
Yeah. I mean, thank you so much. And I myself is so impressed, with RWDN is doing. And thank you for being who you are, being always be humble, and recognizing, acknowledging other people's effort, being a leader, especially to our women and refugee community in Malaysia. I know that you are working so tirelessly, restlessly, for these people, and there's no words for me to explain, about who you are, and about your efforts, as you always know. And thank you for being, I so happy, to hear every time, you speak, or Saida speak, other people speak about RWDN. And at the same time, it's very emotional for me to hear, because I left RWDN thinking that, I don't know what will happen tomorrow, but it had become better and better and better. And, the work becomes so huge that, we've been reaching so many people, so many different people. And most importantly, we are not just working for women and children, we also work for men, right? And, we be there for men, we try to, do what we can. We focus a little bit more about women because, we feel that, they need more help. But thank you so much. There's a lot of information you share, and I'm sure the audience and the speakers and, have learned so many from you and have questions, to ask from you. So let's divert the focus to someone else. I am so excited to, introduce our last but not least, our fifth speaker, Veena Pillai. She is, one of the person that I know when I was in Malaysia. We worked together before on some research, and we were in contact. And she's been amazing as always as well. So Veena is a medical doctor at MSF. She has worked with for the refugees since 2015, and especially with the Rohingya community since 2017, in both in Malaysia and Bangladesh context. Veena, we are excited with your presentation. Please go ahead, dear. Looking forward to hear you.
Hi, I'm just sharing my screen. Can you see this?
It's clearly visible.
Okay, great. Thank you so much, Sharifa. It's so nice to be working with you again, even if in a webinar. And I am so thankful to the organizers and everyone who's here today. I know that we have to be mindful of the time, and I think we're losing participants as it gets into the night. So I'm going to just do this overview very quickly so we can move to the next part of the presentation. And I'm also very glad that Dr. Perveen went first, because she said a lot of things that I wanted to say in this presentation, but she said it much better than I would have. So again, I'm Veena. I'm the medical team leader at 2 health facilities that MSF has in Cox's Bazar in the refugee camps. And I'll talk a little bit about my experience and what I've seen here and the impact of COVID-19 on the community in the camps. So just a quick look at the numbers. As of 31st of August, Bangladesh has seen about 1.5 million confirmed cases and 26,000 deaths. Of these, in the Rohingya population, as of 31st of August, there has been 2,418 cases and 46 cases in the last 7 days. I say that because things are increasing this year. If you look at 2020, there was only 367 cases and 10 deaths during the first wave of Bangladesh, and things had been managed. In the second and third waves, things got a bit higher, and as it got a bit higher for the community as well. And a total of 26 deaths. Now, when we look at the different ways the population has been impacted, the first way is by the actual COVID-19 infection. So when first COVID-19 came, and the idea of what would happen if COVID-19 landed in the camps was very stressful to everyone, the community, the NGOs, everyone, because we thought, given the very poor living conditions that Dr. Ambiya had already described, the lack of ability to physically distance and wear masks and access to water and sanitation and things with that, this is so limited. And these are the things that we thought could prevent, that we think can prevent COVID-19. So we really feared the worst, and all people were working to try to make sure that the impact was minimized. So now the impact is smaller than we thought, but of course every case matters, every death matters, and I'm not suggesting that it has been no impact, but it has been less than we expected. And whether that's because there's not enough testing or any other reason, it's still trying to be figured out. But also, as Dr. Perveen said, like, we can't be comfortable now. There are variants coming, people are not vaccinated, and we just have to still be cautious and be testing and take our precautions as we go. We also know that COVID-19 doesn't just impact you from the infection. Yeah, we have all these related security measures in all countries that have an impact on you too. So there's also the impact of the COVID-19 lockdown and all the related security measures that happened in the camp. And the last one, which I think is an interesting thing from being on the ground seeing, is the global pandemic had resulted in a lot of NGO supply disruption and a lot of disruption of movement of international staff, which ended up in a lot of gaps in services. It ended up in lots of impact on the services that we normally regularly provide in the camps. Also, because everyone was so fearful of the impact that COVID-19 would have on the camps, there was deprioritization of non-COVID-19 health issues. And so many other things like vaccination and NCDs and other things, maybe even like protection for gender-based violence, all these things were deprioritized to focus on COVID-19 and left gaps as well. So this is another way COVID-19 had an impact on the population. So what did we see? We saw increased barriers to healthcare. We saw people being everyone around the world, including the community, the Rohingya community, so scared of COVID. It's so scary. We don't know this virus. We don't know how it's going to hurt us. We don't know how it's going to hurt our families. So there was a lot of fear in going to facilities, because fear that they may be tested. If you don't understand the infection, you think maybe I'll be tested no matter what my symptoms are. So there was a lot of delay in coming to hospital, delay in seeking care, which has a bad impact on health in general. On top of that, the security measures that came with the lockdown made it quite difficult to access healthcare centers. Particularly this year, we had quite strict checkpoints in a lot of different places where people couldn't cross unless they could prove that they had to go to the hospital. That's very hard to prove without any kind of documentation. And it's already been mentioned twice, but there's been a severe increase in gender-based violence, particularly intimate partner violence for women, but also adolescents, both boys and girls. Reduced sources of income, disruption of education for children and adolescents, with all learning centers being closed. On top of all this, living in the camps is difficult for the community because it's also compounded by fires. We had a major fire incident in March of this year that wiped out a few health facilities, including our own, as well as so many people's shelters and all this, and as well as the trauma of having experienced this fire. There's also the monsoon season, which is also very difficult, and a lot of landslides related to the monsoon season. So already the conditions are difficult, already life is tough. And the compounding effect of COVID has resulted in what has already been described but much better by other speakers. So so this is just a kind of a quick summary, and it's already been spoken about in more detail, and we can discuss it more in Q&A if you like. But I'm just going to go over to like what MSF does in Cox's Bazar. So for those of you familiar with MSF, you know we have different operational centers, and in Cox's Bazar there are 4 different operational centers. Among the 3, these 3 that I've got listed on the slide, we have 3 primary healthcare centers and two major hospitals, all doing COVID testing in their own way as outpatients or as inpatients. But I just want to talk a little bit more about my section, which is the Dutch section, and what we do in our services. So we have Kutupalong Hospital. With anyone who is familiar with camps will be familiar with this name, where we have inpatient and outpatient SARI departments. Balukali SOPD, where we have outpatient department for testing for COVID. We also have, and we mentioned vaccinations earlier. We work with the health sector to provide COVID-19 vaccination. Our first campaign was last month for people over 55 years of age, as Dr. Perveen said. And so last month we vaccinated 1,800 people, and that vaccination program is slow, but it's ongoing. And also, of course, we have an outreach program which did a lot of health promotion and COVID-19 messaging. And lastly, just last month, we activated Robert Garden Health Facility, which is a 16-bed inpatient department for confirmed and suspected severe and moderate COVID-19 cases. And that's all. And I'll hand it over to Sharifa. Thank you.
Thank you so much, Veena. I mean, as we know that, in Bangladesh, there's so many things going on, especially with the fire and things like that. And in our webinar previously in Rohingya language, we did discuss and cover about those situations. And thank you for sharing with us about your work and MSF. Before we go to our question section, Brother Ali Johar would like to finish his speech, he would like to provide a bit more information related to our project. And after he's finished with his talk, we will be opening the floor so that the speakers can ask questions. And Brother Ali Johar, the floor is yours. Hope you will be able to finish it.
Well, thank you very much. It has been a very, immense pleasure for me, and also I definitely believe to others, to listen all the, prominent speakers who have huge knowledge on our community, especially during the pandemic. They have been actively involved in, helping our community, to ease the situation for our people, especially women, children, and everyone. So as I'm to cover the rest of my area where I couldn't reach out from my previous presentation. So the project, as I was telling about, it's a threefold project where I have already lighted on twofold. That is, one is on a study that we have done with a community in Bangladesh. Actually, although our project implements in 4 countries, especially Myanmar, Bangladesh, India, and Malaysia. We only did our study with population in Bangladesh, but we have reached out to other countries with COVID-19 information, online information. Like we had 3 webinars where we had thousands of people, joining us, like prominent Rohingya activists, teachers, students, women speaking of their experience during the COVID-19 and how they have been coping up and how they have been helping each other. Especially Veena was mentioning about fire incident, and I'd like to mention about how additional barriers during the COVID-19 have devastated our community situation, especially in refuge countries like Bangladesh and India, like continuous constant fire incidents in Bangladesh and in Delhi have devastated our community more further, and floods, heavy rains have destroyed several shelters, making lives more difficult. Especially women had to go through a lot of difficulties during this situation, when they don't have access to hygiene materials, when they have to face such emergency situations. And also in light of India's situation, like detention have been a case where a community had to face a lot, and also insects biting at the refugee camps where several people have died during this COVID-19. So, as Nasha was mentioning about Malaysia, the similar situation happened in India as well. I'd like to lighten. Like we were getting calls, SOS calls from the community member during the first phase of the COVID-19, when government suddenly started lockdown, as our community mostly work in construction laborer section and also informal sector. That is the sector in the livelihood which has been very much impacted. And suddenly all the people, majority of our community have lost their livelihood, and they were making SOS call where they were mentioning, we might not die of COVID-19, but definitely if we don't get any support, our children will die of hunger. So as I was mentioning earlier, we had 20 active volunteers in the field, 10 female, 10 male. Our 10 female, very active female have reached out to 800 women, and these women are from household who have reached out to all their families, and also our male member, active male member, who have supported us to reach out to and collaborate with 80 religious leaders who have continuously spread awareness about and raise awareness about COVID-19 and how to, observe the government instructions to help our community to, in responding the COVID-19. So the study we have done, has again threefold. It has a demographic information. We'll definitely share all this detail and all the finding reports on our website, RWDN website, and also ISI's website. At the same time, R4R website, that is Rohingya Human Rights Initiative. So the second section is about living condition in Bangladesh, as our survey and our study only focus on in Bangladesh and cross-bordering situation with Myanmar and India. And the third is impact of COVID-19 pandemic on Rohingya refugees. That covers a lot of section like access to female hygiene materials, income and livelihood during the pandemic, and how community have been have access to information about COVID-19 and awareness, education during the pandemic, as well as safety in the camp during this crisis. So this the survey on the impacts of COVID-19 on Rohingya refugees population in Bangladesh was conducted on dozens of people we have interviewed through online and offline means. where we have people from Camp 1E, Camp 1 West, 3, 4, 5, 6, 8, 8 West, 9, 13, 14, and 19. So we had kept, gender as a balance, where we had interviewed actually 52% female, with the respondents, 68% were married and 20% were single, 12% were divorced. Besides that, we focus on including vulnerable groups such as elderly people, 4%, and vulnerable young refugees between 15 to 20 years of age, that is 16% of the respondent. And the average structure of the Rohingya refugee household of our respondents show that most commonly, a family has 3 children. All together, like the household has 5 members, including the elderly or adult siblings. So a total of 76% of respondents mentioned that there are vulnerable members in their household. Out of that, main person with prolonged sickness, which is 57%, elderly, who are 65 years or above, that are 65%, and pregnant women or lactating mothers, 25%, and persons with disability. So most of the respondent arrived, almost 70 plus person arrived in Bangladesh during 2017 or after 2017 military crackdown in Myanmar. So around 12% respondents said they have come after 2018. Living condition, if I from our study, majority of the respondent, 88% respondents said they live in tarpaulin made shelter, where walls are made of tarpaulin and jute sticks and stakes. So 56% of the respondents expressed that they don't have access to adequate shelters during the pandemic. So this claim is again supported by other evidence, like such as 84% respondent do not have washroom and toilet at their household, and 76% of the respondent don't have bathing corner in their household. So some wash facilities are available at the community camp level. For example, 80% respondent expressed that having access to cleaning water, community and hand washing point to the close to their house, and like 100% of the respondents said they do have access to drinking water. Between 48% to 56% female respondent also mentioned that there are no separate women only toilet and bathing corners in their surrounding. Some women also expressed that it is not possible to use the women only toilets and bathing corner, as they are far away from their shelters. That has been a very big concern. So for the hygiene product, they don't have access. We have the dire living and hygiene condition of Rohingya refugees in Cox's Bazar camp points to its inhabitants' vulnerability. The camp inhabitants are at high risk of COVID-19 spread due to insufficient hygiene conditions and inability to perform the preventive measures because of the crowded and polluted situation, cramped situation in the camp. So access to female hygiene materials has changed significantly with COVID-19 pandemic. Only 15% women said they have access to female hygiene materials during the COVID-19 pandemic, and 54% women reported they had access to female hygiene materials before COVID-19 pandemic actually started. So following the survey finding, we have verified the scenario with our field team in Bangladesh. we decided to change the concept in, of hygiene package, where we have, earlier we thought of providing refreshment, but instead of refreshment, we have come up with an idea where we have supported our female participants with a small hygiene packet, including soap, mask, as well as sanitary pads. So from our survey, it became evident that the COVID-19 pandemic and related lockdown, instability, on the job market have significantly impacted the Rohingya refugees. Most Rohingya refugees earn their living as daily laborer from the support of NGO donations and remittance that are being sent by their relatives from foreign countries. The vulnerability of these families has significantly increased as many of them lost their jobs. Their health got affected and other impacts occurred. So from the finding, we have found that average monthly income of a family in Bangladesh is 9,160. That was before COVID-19. So during COVID-19, it lowered down to 5,441 taka, and like it is around 50% decrease in their income. So if I may mention about the exchange rate, as we do have some international audience as well. So one euro is equal to 100 Bangladeshi taka. So now you can imagine like how the severe condition with our community in Bangladesh about their livelihood is. So all interviewed Rohingya refugees reported that their families have already adopted, one or more negative coping mechanism due to COVID-19 and lockdown related changes. Like 85% of the respondents decreased their consumptions, mostly mentioning reduced consumption of children clothes, meat and oil and daily needs, as well as hygiene materials as well, like soap, washing powder, and other sanitary items like toothbrush. So besides that, other negative coping mechanisms were established, like skipping meals were also one of the concerns raised by our respondents. So from a case study, if I may share, one female respondent mentioned that her income decreased after COVID-19 before she received remittance from her relatives abroad, like 8,000 Bangladeshi taka, and that came down to 3,000 Bangladeshi taka, and she has been facing with severe medical condition, and she is afraid if she gets infected with COVID-19, there will be no one to look after her because she lives alone, and she has only support from NGOs that are there, but definitely without family members for a single woman, it would be much more difficult than an average person. Like for awareness from our research, over 92% responded said they have received information from various sources and they trust the information they received. A number of respondents said like being actively involved in COVID-19 measures under the local and international NGOs as volunteers or other position. So despite this positive outcomes, the data show that there are vulnerable groups who have much lower access to COVID-19 information, which only deepens their vulnerability. So these groups are women, pregnant women, lactating mothers, persons with disability, elderly person, and also people who have no access to digital information, like who don't have access to smartphone and internet as well. So most respondents had at least basic information on COVID-19, stating that viral disease, highly contagious, disease, infectious virus, and so on. So most of the respondents were able to state the main symptoms of COVID-19. The mostly frequently stated that was a fever, sore throat, and dry cough. So we have also asked Rohingya refugees for the most common reason why other community members, we have found that there are some communities who are not being observing, who are not able to observe the social distancing and wearing masks in public. So we have asked these questions to common Rohingya refugees there in camps, follow the protective measures. Though the most frequently stated that reason was no trust in effectiveness of the measures. So followed by health condition and physical or mental limitations of individuals, like this have fueled a lot. On the other hand, religious leaders, religious reasons, and in institution mistrust in institutions, sharing the awareness messages are also comparatively low. So in the following section, I would cover information on COVID-19 spread, where various sources, they have shared that by the official awareness sessions, as well as the word of mouth, and the majority of the respondents received COVID-19 related information from local, international NGOs. Around 92% people respondents said they have informations received from NGOs or either their family members and friends and communities. So 60% of the respondents said they have shared the information with their relatives further, especially relatives in Arakan, because they feel that they don't have proper access to information. So whatever information they have trusted on, they have shared further with their family members.
Brother Johar.
Yes. So I'll just conclude.
Yeah.
The respondent mentioned as the main contributor of the assistance ration was NFI provisions, other services like the international NGOs, local NGOs, individual support, and the government support. The respondent were asked to mention the NGO that they know and provided support from. Like we have came across name like BRAC, WFP, DRC, IOM, UNHCR, SCI, CSI, SCTCD, Red Cross, Relief International, MSF, definitely, FRPB, CARE International, and also other government agencies like broadcasting and all. Thank you very much.
Thank you so much. And I think we, like Ali have mentioned earlier, if you want to see our, final findings, the reports, you can obviously look at our website. And if you have questions related to our this project, you are more than welcome to ask. So without taking a lot of time, let me go through some questions that our participants, audience in our Zoom have listed. So let's start from Sister Vaishali. She said that thank you for bringing light on the issues faced by the Rohingya communities during the COVID pandemic in different parts of the world. I will be very interested to hear about the experiences of the Rohingya women during this time, especially in cities like Delhi and others in India, because the Rohingya community is not legally recognized as refugees in a country like India. I am trying to understand what kind of issues that had raised for the community here. I think Ali Johar can answer that as you are there. Brother, go ahead.
Thank you very much for the question. I think it's from Vaishali. So yes, you have found it right. India did not sign 1951 convention, and it neither has a policy to tackle the refugee crisis. So policies always vary on the government, ruling government, which come to power. And recently, on light of the COVID-19, our community, especially women, had to go through a lot, like the similar situation in Bangladesh regarding rise in domestic violence, as well as inadequate access to healthcare and also hygiene materials. So fortunately, for people in Delhi, particularly, there are several attention from various government agencies, as well as international organization and local organization. But the situation is very devastating for locations which are not in Delhi, especially which are in remote area where organizations, especially implementing partner of the UNHCR, reach out very hardly. So they have even faced with their rations. Several people, majority of the people reported they had to cope up with negative practice, like they had to go undergo without food, and also during the pandemic they had to go out for work when the people were severely afraid to go out, so they had to risk their life, even their family members' life, by going out to search for livelihood options.
Thank you, Ali, for the answer, and I hope you got your answer. And secondly, I think Vaishali is the same person who asked another question, which is, she said that I will be very interested to hear about the kind of relationships or bonds that may have been formed during the pandemic, especially bonds between women or female relationship. What does the aspect of friendship do during time of crisis, like a pandemic or even the crisis that community had faced given the atrocity in Myanmar? And I would like to direct these questions to our Dr. Perveen. Dr. Perveen, if you may answer this question.
Thank you. Is it what I understood is the bonding? What does the bonding as a friendship bonding among the in this crisis? What did I understand the question well?
I think I understood the same.
Okay, good. Vishali, thank you very much for the question. The thing is that solidarity, it helps a lot. And solidarity in any issues, especially when you are suffering, when you have been neglected by your own country, when you have been neglected by the society, when you are the victims, and when you have managed to survive and build a resilience within yourself. So solidarity always helps. And solidarity does not mean that, what do you say, that we only specifically talk about only about the friendship, for example, with one another. But solidarity also means that you keep connections with them, you talk about them, you make the awareness about them, and not keeping the silence. And this and these days especially, before when somebody is suffering, when somebody is going through the crisis, a group of people, it is very difficult to reach them, every one of them individually, due to the social media, and due to the COVID has shown us that we can do a lot of things on social media. And then, so through the social media, we can connect with each other, showing our sympathy, our empathy, and our, what do you say, conciliation, our understanding, and especially for the people who are vulnerable. And so it's very easy to reachable, and we all know why we all people suffer in this COVID-19, not only because of the financial crisis or not because of the medical crisis, it's also the mental crisis. You know, we all went through a very horrible mental disasters. You know, people before it's not like people cannot go out, but people could not also interact with each other. So there was a massive mental destruction happened within our people, especially with the Rohingyas, especially with the people in Myanmar. We should not forget our brothers and sisters in Myanmar, how they went through and how they are still suffering. So it is important if we can reach out them. As I've said, social media has shown that these days it's very easy to reach them instead of going to them individually or personally. And I would also request the panelists, you know, Veena, Nasha, and Natalie, and Ali, that we have to focus also on the mental status of our people, because we are all the time talking about the medical issues, we are talking about the social issues, and we are talking about the repatriation, political issues, and all those stuff. But if my soul is not healthy enough to join joy all these whatever I get in future or today, it will not help us. And you know, in the medical issues, when you, for example, if you have a headache, you go to you take the medications, and within 2 hours your pain is gone. Or when you have a stomach ache, you go to the doctor sees that you have an appendicitis, he operates you, the surgeon, and after 5 days you are discharged. So there is a very high likely that medical issues you will recover 80% to 90%, but whereas only 20% people with the medical issue, with the mental issues, they will be recovered, and it will take years and years. And especially our Rohingyas who are suffering in the camp, and also not only about the, it's not about them in Arakan or in Bangladesh, even in India, we have forgotten the Nepal, we have forgotten Sri Lanka, we have forgotten a huge majority living in Saudi Arabia, in the Middle East countries where they were living. They have been also broken due to the COVID. They're suffering too. So it is very, as I've said, and especially for the Rohingyas, we don't understand. You know, there is a very proverb or a word that one of our doctor oftenly use. We go to the doctor when we are suffering. So mental issues, usually, you know, it's a taboo. It is not very much widely open. We're talking about it. And then it is important that we concentrate on these things, because without you're not feeling well emotionally, you will not be able to live longer, and the treatment will take longer. And I don't know whether Veena has said or not, there is a very lack, and not only the information, but sources for the to maintain the mental hygiene in the camps. And they are exposed, these people were persecuted for long years, and they are not only the survivors, but they are the victims also. And their atrocities, regardless of freely they are living, maybe they are somewhere moving before the COVID-19, but they are restricted. There are no basic fundamental rights have been given to this 1.1 million Rohingyas. So it is also, therefore, they are daily stress factors, and they are open to every psychiatric disorders. It is very much important, and I will request Veena, especially the MSF, if you people can provide some sort of mental treatment or therapy, or the trauma therapy, which is very much needed by our women and our children. Thank you.
Thank you, Sister Dr. Ambiya, for explaining. At the same time, I think I will also I typed it somewhere. Also wanted to ask the same questions from the MSF or Veena. You know, if you guys have any kind of program or activities that is there for women or children or even men, who are dealing with daily trauma and this kind of situation. Is there any efforts or any work or activities is there or form, or you would like to form in the future? I mean, if you can give us a little bit of insight about that, if you don't mind.
Yeah, no, it's a very good question, and it has been recognized by most of the health facilities in the camp, because even in Malaysia, when I worked, it was very clear to me that so much of the burden and the physical burden had mental health sources, because the trauma and the repeated trauma of the journey plus the conditions that they live in, it's like almost like trauma every day. So we actually have mental health facilities in, I think, almost all the sections have it. Definitely from OCA's side, Kutupalong and Balukali have quite a robust mental health program where it's outreach mental health work, as well as psychiatry and individual counseling, group counseling, psychological first aid. It's quite good, but of course, no matter how good it is, there's more work to be done, and there's so much more that we need to do. For Balukali, we definitely are trying to make all our services trauma informed, which means that we treat every patient that walks in the door as somebody who has been potentially experienced some trauma and therefore needs all the very sensitized and sensitive kind of service where we have privacy and give them space to tell us if they've experienced any gender-based violence or mental health, have any mental health distress. So we're definitely addressing it. It's definitely clear to us. It's clear that this is such a huge need, and of course exacerbated by the whole pandemic. But yeah, I'm happy to answer any more specific questions. Thank you.
Thank you so much. I have another question. It is from me, actually. I think I heard from the presentation of our Dr. Ambiya. I'm not sure if I understand it clearly, but I would like to know, any of the speakers can answer these questions. So examples now in Arakan, right? So there is, every day we have been hearing the spread of virus, people are getting affected, and a lot of things been happening, and at the same time the community in Arakan don't have clear understanding of the virus, how to prevent it and stuff like that. So what is the effort? I mean, obviously we know that have to be work through social media, but at the same time, I think it's important to work directly in the community there. How can we work, with the people there? How can we create awareness in Arakan to, prevent the virus, and at the same time, the vaccine. What can be done, for that, so that the people in Arakan get vaccinated and get prevented from this virus? Any of the speaker, if you like to answer the question.
Okay, I think the other speakers also can speak up. Unfortunately, we have so many other issues in the Rohingya community that is very difficult for us to focus on such things. As I've said earlier, we don't go to the doctor unless we don't die. When I'm suffering, I have the less oxygen, my blood pressure is getting down, and then I go to the doctor. So with the COVID, social media has played a vital role, the informative also, but at the same time, it has played also negative roles. For example, there were people, I heard in Malaysia, and there were people from the very civilized countries, our Rohingyas were calling me and asking me, whether I should take Moderna or whether I should take BioNTech. I heard the BioNTech Pfizer is better than, such kind of these informations, people are very reluctant to take in vaccinations. Whereas also our scholars, unfortunately, some of the elders, they don't understand the consequences, the hardships, the death of this virus. So what a lot of words were manipulated among our community, because we don't understand, we have to understand that this virus does not understand, or it has no limitations of the color, of the religion, of the genders, it now, even before, it was only affecting or attacking only the underlying people, and now even the children are becoming out of it. So it's very important, you, me, we don't go only in Arakan, we have to start with within our people, you know. As I've said, our people are not taking it very serious still. So education, awareness, education and awareness. Whereas the vaccination is concerned, you have seen 1.1 million Rohingyas are living in Bangladesh, and it's still only, according to our Veena, it's only 1,000 something has been, and whereas I have read it's about 4,000 have been vaccinated, only first dose. What about the other rest? So we all are protected. With the whole world will be protected when we all of us will be vaccinated. So in the Arakan, it will be quite difficult, but for the time being, before the vaccination, because there are political issues are also there. Of course, we can make the campaign, we can request the international community, we can request the people who are taking power, like a political NUG, ULA, Arakan Army, and other NGOs who are working, and the politicians who have the access to the Arakan, to request them to give the vaccinations to all of them. But for the time being, we have to make sure the awareness program, the educational program, that the preventive measures, the social distances, first you have to understand the dangers of this disease, what it can do, because all of us have been affected by this, not only financially, morally, but mentally. For example, my sister is today, though I've been vaccinated long back ago, being a doctor, I thought, you know, I am now doing well and nothing will happen. Same thing with my sister. She's a doctor herself, serving in Abu Dhabi in UAE. She got her vaccinations long back ago, and then she got the, while treating the patient, she got the Delta. You know, now she's in coma for the last 8 weeks. So we have to understand the dangers of this disease, and we have to campaign for vaccinations. We have to campaign for preventive measures till the vaccination does not reach by all of us, not the first dose, even the second dose. And the preventive measures, you know, we have to also, we have to understand, we have to make them understand, take care of their mental status, you know. Okay, we are talking about very easy for you, for me, living in very civilized countries, Europe and America, that we talk about social distancing, we talk about not going out, we talk about no education, we say you should sit down, where these people are very limited social, psychosocial support, very limited. So we have to also mentally support them and making the awareness. Thank you.
Thank you so much. You know, it's very informative, and yes, we all have to vaccinate it, and nobody's safe until all of us are safe. I don't have any other question from my side. If other speaker would like to, you know, add your final comments or remarks before we end, or, you know, if the audience would like to ask questions, and I guess there is no other question from the audience, but if you can, you know, we already quite a little bit late, so if you can, you know, end with your remarks, I will appreciate that, and anyone can go first.
Okay, if I may, because I have to run. I just wanted to really thank you, all of you. It was quite effective. You know, I have been trying to, or whatever I can, politically and medically and mentally, but this has been a very effective to me. Especially I thank Natalie, I thank Nasha, I thank Veena, and I thank Sharifa and also Ali Johar. Your research, the project or the research that you have done, it's tremendous good. I think we should continue such kind of things, and I would request Nasha and also Natalie and Veena, if I can be in any service to you people, because my interest is not only to liberate my people politically, giving the rights, but also to maintain their well-being, and especially on the mental hygiene. So especially for the children, if you need anything, you know, of course I'm overloaded, but I have always ears and eyes and time for the people who take care of my people. I thank you once again for taking care of our people, Rohingya. Thank you.
Thank you so much. We always appreciate your hard work and your contributions, and we know that you always be there. And personally, I have a little of question to ask about my daughter Amira. I will also call you sister. What happened? I'm panicked. So thank you for always be there for me, for for everyone, for the Rohingya community, everywhere. So thank you so much for giving us your time, and thank you once again, for joining us today. Brother Johar or Sister Natalie or Nasha, any one of you would like to, give your final remarks or comments, go ahead.
I think I can go, Sharifa. Thank you. Really, just to echo what Dr. Ambiya was saying, that it's been a very positive experience listening to you all and all your commitment and all of the things that are coming out of the issue. And I really hope that in this talk we've picked up a lot of the broader threads, in terms of, Dr. Ambiya's particularly talked about the mental health aspects of it, but also the broader aspects of, the right to health and all the other human rights issues that come off of that. And I really hope that this project, as well as all the other work that's gone on within the Rohingya community, becomes a springboard to work on health issues and human rights in this way more effectively. Thanks so much for having me today. It's been really wonderful.
Thank you so much, and it's really an honor, for me, especially to host this webinar, which with a lot like no experience at all. I think this is the first time I'm speaking English, hosting a webinar and having all of you, so amazing. Which I look at, I get inspired from all of you, and it's been an honor for me to, host all of you. And thank you so much for giving your time. Now, Nasha, please go ahead if you want to give your final remarks.
I've actually just been really impressed with you. I just keep thinking, every time you speak, I'm just like, this girl is just doing amazing, amazing work. Thank you for the invitation. I feel like my sharings on Malaysia was very humble, like in comparison to the wonderful work everyone else is doing and the very important work that still needs to be continued. I'm sorry, at this moment, all I'm thinking is just that I'm hoping not just my community leaders, but everyone at RWN is watching so that we can reflect on this together, because there's just so much that needs to be done. But most insightful has all the information that I've gathered today. It's a lot, but I really hope that internally with the team, we want to talk this through and see what we can continue doing. But really, thank you so much for the sharing. It's more than that I could find online, I could read. It's great because it's coming from people on the ground, and this just that rarely happens, and it's been really, really great, insightful. Thank you so much.
Finally, Brother Ali Johar, which is also my cousin. It's been a great colleague, to work together in this project, and we struggled, we fix things, and we make it in the end. And with a lot of work which which I always believe to empower people, which from this project is not just we collected information or just go there to create awareness or section with the community, but at the same time we empower people that work with us, not only with skills based but also financially, so there is 9 months salary, implement that job that the community get as well through this project. And I think it is important, like our Sister Natalie have mentioned, that the Rohingya community organization or NGO also can work better like other international organization and things like that. And we have direct connection, we have direct link with the community, we understand community much better, so it's been really amazing journey to share with you, Brother Ali Johar, and the floor is yours.
Well, thank you very much. I would definitely love to extend my, gratitude to Nasha, Sister Ambiya, and my always support Natalie, who has been a very good mentor to me. In every community's activity, especially in research and writing, and also the award I have received from SCI, to lead my research and all. She has been a very good mentor and support. So I'd love to extend my thanks to our team, especially without whom this project, research, implementation, respond to all the challenges, what never possible. Especially our volunteer team in the field, 20 people, 50% female, which I am really proud of. Like, we have 30 members in the team and 50% of them are female, including one very talented and active member, a non-Rohingya member, Erika. Without her support, all the research and our documentation was was never possible the way we were able to do in success. And at the same time, our webinar team comprised of Sister Sharifa, our two very talented sisters from Bangladesh. They are university students, Tafrida and our sister Perveen. So we have our field coordinators as well. So due to privacy reason, I can't maybe name them. Also, due to privacy reason, I can't name our volunteers as well, but they are the one who have led this project into success. And like all the participants here in the webinar, also all the youths who have been immensely supporting in our activities. Also, there are two youth groups we are going to award with at the end of this project, who have immensely supported us, and we are in decision of supporting them with some COVID response materials, and that will be an honorary support. Also an honorary support to all our team members. And especially thanks everyone for making it a success, especially Sister Sharifa for leading all the stress full webinars and online campaigns.
Thank you so much. And once again, thank you so much. I mean, in the end, I would also like to mention the, ISI for giving us this opportunity. This project was just came across when we talked with, the co-founder, Brother Amal, and, with Brother Johar, Natalie, and me. And then with three of us, we decided that we need to, work together, form something for the community. And we invited our sister Erika. From there, the group become bigger and bigger, and the work have been, undertaken with very effectively. I won't take long, time, and I would like to thank all the audience from the day one, from the webinar one until today, who've been really supportive and, attending, listening, asking questions, giving your time, and also all the speakers, guest speakers who are, giving all of your time, your input, your energy on this, and, doing your work, for betterment of the Rohingya community, be the supportive person that you always been. And I can say go on and on and on. But thank you so much for coming and giving your time. Thank you everybody. Much of love from me. Be safe. Take care. Assalamu alaikum. Bye bye.